The notion that estrogen is always bad for breast cancer is, I think, something that is a story that hasn't been told correctly. Yes, we do know that if a woman takes hormone replacement therapy, which are synthetic estrogens with synthetic progesterones, we know that over a period of time that can increase risk of things like breast cancer and other things as well, heart disease, dementia, stroke. We know that, published in the Women's Health Initiative Study 2002. However, there are actually three types of estrogen. There's the main active estrogen, which is estradiol. We have estriol, which is actually the safest estrogen, and estrone, which tends to be the dominant estrogen produced after menopause. Now, all three of those estrogens have different profiles. Estrone is probably the one that causes more of the negative symptoms. Estradiol is somewhere in the middle. Estriol is safe, and in fact there are some trials which have used estriol to treat breast cancer. But there's a further complicating factor to this story, and that is the estrogen levels per se may not be as important as the way a woman breaks down estrogen. And there are two key pathways that every woman will use to inactivate or metabolize her estrogens. One of those pathways produces toxic waste products, and those toxic waste products can potentially damage breast and uterus. And there's another pathway which is safe, and they are not damaging, and those products are excreted safely in the urine. So these can be measured. It's a simple first morning urine test which tells us what proportion of both of those pathways are active in any particular woman. So here's the crux. Before a woman is given hormones, and particularly estrogen, and before she's given HRT, even if it's a bioidentical natural estrogen, you want to know which of those pathways is most active. How is she going to metabolize those estrogens? Is she going to metabolize them favorably or unfavorably? In my view, every woman who's ever going to be put on any kind of estrogen should have that test done first, because it's a way of establishing, are you going to increase that woman's risk by putting her on hormones? Now, in my clinic, any woman that ends up on a natural estrogen will always have that test done, so that I know I have that information about that woman, and I know that I can then do something about that estrogen metabolism if she turns out to have an adverse metabolic profile. It's very easy to change nutritionally. There's a simple nutritional trick for changing that woman from a toxic estrogen producer to a non-toxic estrogen producer. What does that equal? It means that basically, over time, potentially that's going to reduce her risk of getting any breast damage from estrogen. So there are ways. The story is not as simple as it's been sold. We have to consider all elements of estrogen, which types there are, and how, more importantly, how estrogen is metabolized in a woman's body.